Hello friends. Today we are going to discuss about practical aspects of cognitive behavioral therapy. That is, how to practice cognitive behavioral therapy. I am Dr. Suresh Bada, Professor of Psychiatry, working at NIMANS, Bangalore. Before I start my presentation, I would like to place this disclaimer. This presentation is for academic and training purpose only. And this is not a substitute for clinical opinion. For clinical opinion, please do contact a psychiatrist. Conflict of interest? None. In this video, I'm going to discuss about effectiveness of cognitive behavioral therapy, how to do cognitive behavioral therapy, steps in doing cognitive behavioral therapy, homework assignments, and how to do cognitive restructuring. This video is targeted to psychiatrists, registered medical practitioners, nurses, mental health professionals, psychotherapists, and counselors. Cognitive behavioral therapy is considered as a gold standard treatment in the field of psychotherapy. CBT is considered as trans-diagnostic in therapeutic approach, is found to be effective in many disorders such as depression, OCD, generalized anxiety disorder, agoraphobia, somatization disorder, tic disorders, eating disorders, PTSD, social phobia, bipolar, and many other illnesses. CBT is found to be very effective. There are literature available in scientific field to discuss and also how effective is cognitive behavioral therapy. In a recent review of 269 meta-analysis of studies found strong evidence to support the use of CBT to treat anxiety disorders, somatoform disorders, eating disorders, anger problems, and general stress. So that means even meta-analysis also talks about efficacy of cognitive behavioral therapy. Not only that, even the long-term outcome up to 12 months, CBT has been found to be very effective and also in preventing relapse, especially in depression, substance use, and bipolar disorder. And also it has been found to be useful across lifespan. That means CBT is useful even in children and also in geriatric population. And the meta-analysis and various Cochrane review clearly says it is effective moderately. That means it is one of the important treatment component used in various psychiatric illnesses. And further, the CBT has been modified. They are considered as third wave of psychotherapies. That is, the modified CBT. Like modified CBT depending upon various illnesses. Like for example, cognitive behavioral therapy in OCD is also considered as exposure and response prevention, ERP. In tic disorder, habit reversal training, HRT, has been done. In borderline personality disorders, it is also called as dialectical behavioral therapy. In PTSD, trauma-focused cognitive behavioral therapy. And the nowadays metacognitive therapy and also mindfulness-based cognitive behavioral therapy has been used across the world. Further, cognitive therapy is not only useful in patients but also in the caregiver to reduce their stress, burnout, burden, anxiety and depression which is caused by caregivers' stress. That means CBT is useful both in clients and also the family members of persons with mental illness. CBT was the first form of psychotherapy tested with most stringent criteria and one of the most effective psychotherapy. That means randomized control trials have been done and meta-analysis of RCTs have been done. And most of the studies indicates cognitive behavioral therapy is very effective. Further, not only cognitive behavioral therapy administered by the therapist, eCBT, that is electronically delivered cognitive behavioral therapy, uses a platform such as using cell phones applications or internet-based cognitive behavioral therapy. They are also been found to be effective. There are various meta-analysis. Meta-analysis includes such as studies done with including 17 studies, some of them 19 studies. They also talk about moderative effectiveness using eCBT, that is electronically delivered cognitive therapy is also effective. And if you look at the scientific studies, it clearly says it is not the experience of the therapist which matters most. It is the motivation of the client, insight into the illness, and also homework compliance to the assignment and practicing CBT matters most. That means if a patient is highly motivated, even eCBT is useful. And also studies also have said that self-administered CBT by using manuals also been found to be effective. Although therapist is required in most of the patients, but if highly motivated patients can do CBT by himself. CBT can be administered by the therapist or else individually who can read books or manuals and administer CBT by himself, or else patients with the family members CBT can be done, group cognitive behavioral therapy, and also which I said self CBT or else electronic cognitive behavioral therapy. So these are the various different ways cognitive behavioral therapy can be administered to the clients. Now let's move into the practical aspects of cognitive behavioral therapy. See, in the suitability of cognitive behavioral therapy should be assessed first. That is, whether the patient is cooperative, whether the rapport is built, whether accessibility of the thoughts, which are cognitive distortions, automatic negative thoughts, schemas, whether the person is cognitively sophisticated, whether he is able to cooperate, at the same time he is able to be aware of thoughts, feelings, behaviors, and emotions, whether he is able to tell about that, and also the events, acceptance of self-responsibility. Although initially he may start blaming the environment, slowly he says, yes, because of my dysfunctional thoughts, this is my behavior and this is my emotion, and he takes responsibility of that. Acceptance of cognitive model, especially CBT, and also he is able to collaborative work with the therapist plays a very essential role. Further, whether he is able to develop a potential alliance with the therapist to work towards the overcoming his illness. Chronicity of the problem, safety behaviors, focusing on the problem, and the client's motivation for therapy plays a crucial role. So all these 10 important points need to be kept in mind before you select a patient for CBT. At the end of the day, homework compliance and motivation of the patient for cognitive behavioral therapy plays a very crucial role. There are some contraindications for cognitive behavioral therapy. They are severe psychotic symptoms, where you cannot engage the patient who is violent, who is having psychotic experiences, hallucinations, delusions, and where you are unable to develop a rapport. In those cases, CBT is very difficult. A patient who is catatonia, who is not speaking, in such patients, CBT is very difficult and it is contraindicated. Further, severe depression with suicidal attempts and thoughts, we have to be very careful selecting those patients for CBT. Further, a patient with moderate to severe mental retardation will not be able to cooperate in accessing their cognitive processes. So these are the various contraindications for CBT. Now let's move into cognitive behavioral therapy sessions. Usually, these sessions are conducted 1 to 2 sessions per week initially. That each sessions will last for 45 minutes to 60 minutes. And CBT usually lasts for 16 to 24 sessions. That means they are time limited. They are clearly, number of sessions are clearly demarked. And cognitive behavioral therapy is a training program where both therapist and the client work towards the common goal of reducing symptoms. It should be a collaborative work between the patient and the therapist. We need to remember, initially the sessions will start 1 or 2 sessions per week. Over a period of time, it may become monthly 1 session. And over a period of time, the weaning process starts. And you need to have a structured sessions in every session. That means you need to plan the sessions. But however, you need to be flexible depending upon the client's need. However, you need to explain the patient that invariably the therapy sessions will be structured in this way. At the same time, you need to invite the client to review the previous session. Tell him what did we discuss in the previous session, and also immediately move towards the discussing homework assignment, how much he is able to complete it. and now discuss about the today's event and about what are the events which has happened in the past 1 week. At the same time, you need to intervention about Socratic questioning need to be learnt. It is a very important tool in cognitive behavioral therapy. And further, homework assignment and summarizing, you need to be very well versed before you learn cognitive behavioral therapy. At the same time, although I'm talking about structured CBT, you need to be flexible. Flexible with the session, and the sessions need to be client driven, and it needs to be semi-structured rather than completely structured. Although I'm talking about the sessions are 15 to 24 sessions, but some patients may require long-term therapy. It depends upon the individual's condition, comorbidity, and how much the patient is able to do cognitive behavioral therapy. In general, cognitive behavioral therapy is time limited. Let's discuss about steps of cognitive behavioral therapy. There are few steps which needs to be mandatorily done in cognitive behavioral therapy. That is, number 1, intake session, baseline assessments, goal setting and psychoeducation, understanding the relationship between cognitions, feelings, physical symptoms and behavior. This need to be understood by the patient. Then only the cognitive behavioral therapy will progress. 5-column charts and homework assignments, identifying dysfunctional cognitions, challenging those dysfunctional cognitions, behavioral activation, exposure therapy, problem solving, weaning of sessions, booster sessions, and relapse prevention. These are the various 12 steps are to be undertaken when you do cognitive behavioral therapy. Every patient doesn't require all 12 sessions. Depending upon the patient's symptoms, this therapy needs to be done. And you need to be flexible, and depending upon the patient's requirement, the sessions need to be tailored. Let's discuss about the first one, intake session. Intake session will last 1 to 2 sessions. In this intake session, you'll briefly discuss about the problems of the patients, discuss and ask what is the expectation from the therapy, role of the therapist need to be discussed, role of the client, and you need to emphasize telling that although it is a cognitive behavioral therapy, it is a training program. We are going to address few of the symptoms of the patients in the therapy over a period of 16 to 24 sessions. Later, the patient need to continue to do cognitive behavioral therapy at home to get the complete remission of the symptoms. Just because he is coming to cognitive behavioral therapy, and if he does not practice, he will not get any relief from the symptoms. Not only that, the complete effectiveness will be seen only after 3 to 6 months down the line. And you need to very well say that in this therapy, that is in the training program, we will teach you how to deal with some of the symptoms. Rest of the symptoms you need to deal at home. Although cognitive behavioral therapy is done on outpatient, sometimes inpatient, it will be in an artificial environment. The real CBT occurs at the real environment at home. Further, joint session if it is required, the co-therapist, taking consent, those need to be discussed. At the same time, session duration, frequency, payment mode, all those need to be discussed in intake session. Further, you need to explain about the structure of each session, homework assignment, contact details if there is any change in the session, timing in the session, if the client is unable to come or else the therapist has to stop the session for some reason, those contact details need to be there. Further, number of sessions, weaning and booster session and relapse prevention need to be discussed in the intake session. If the intake session is very good and the patient is able to understand his role and expectation is clearly demarcated, the therapy will progress very beautifully. Baseline assessment. In this, you require to assess the patient's problem, focusing on what are the issues which brings him for therapy, which may last usually 1 to 2 sessions. But if the patient has comorbidities, you may have to do 3 to 4 sessions for assessment only. In these sessions, you need to focus on 6 important F's. First, you need to discuss about their health problems. It may be physical health problem or else mental health problems. Further, after that, you will be discussing about the family issues. Are there any family issues which is triggering his problems? And also discuss about the friends and relationship issues. These are the things where Cognitive errors, distortions plays a very essential role. Financial issues, work-related issues, what are his free time activities, what are his future related worries. These are the important things you need to talk with the patients before you enter into a structured assessments. That is using scales or looking for cognitive distortions. Those assessments need to be done slowly over a period of time. At the same time, you need to talk about psychiatric assessment. If the patient has depression, you need to do a structured assessment. Collect information from family members. If there is a referral from psychiatrist, look at the file, do the severity rating scales, if required certain investigation, if required psychological assessment, and formulating the plan of action. During this baseline assessment, you also undertake psychoeducation. If the patient has obsessive compulsive disorder, you will discuss about OCD, how the symptoms have originated, how they are maintaining, what are the ways to overcome this OCD needs to be discussed. That means psychoeducation of the illness need to be done not only to the patient, to also to the family members. Because many a time, these are the family members who are going to help the patient to do cognitive behavioral therapy at home. Now, after you have done these sessions, you will now enter into goal setting. Because without goal setting, the patient will not move further. Here in goal setting, you will ask the patient, what is your goal in life? What is the goals in the therapy? Long-term goal and short-term goal. And from when you ask these such questions, patient invariably will talk about general goal settings. They will say, I would like to be happy. I don't want to be depressed. These are all general goal settings and they are long-term goal settings. Now you need to discuss with them. To be happy, what you should do. What is the next important step you have to take? To not to be depressed, what are the things you need to do from today? What are the things you want to change in the next 1 week? The next 2 weeks? That means the goal setting should be very specific and time-bound, measurable and objective. And you need to be very clear. Goal setting should be flexible and it should be a collaborative work. The therapist will not dictate the goal settings. It is the client who is going to dictate it and he will carry on these activities at his speed, not at the speed of the therapist. General goals by client, which I mentioned, will be, I want to be happy in life. I should not have depression. I want to be success in life. These need to be brought down. These need to be broken down into simpler, specific goals. Then only you will be able to monitor them, measure them, and administer the goal settings. The best way of understanding this is SMART. They should be specific goal setting. They should be measurable. It is achievable. Don't give him a task which is very difficult to achieve. If the patient is depressed and you are given a task which he cannot achieve, that means he will become further depressed. Hence, it is to be realistic and the time scale should be clearly determined. So SMART is the only way to go for goal setting. Now, once you have done this session, now you have to move into the important component of cognitive behavioral therapy. That is discussion about thoughts, feelings, physical symptoms, and behavior. You have to spend 1 to 2 sessions here. At the same time, you have to do psychoeducation of the illness because psychoeducation is a continuous process. Patients need to know about their illness and what are the different ways to overcome them. And CBT is one of them that needs to be continuously emphasized. Here, you need to discuss about thoughts, emotions, and behavior with the patients. Client need to understand the relationship between these important stakeholders. If the patient is able to delineate between the thoughts, emotions, behavior, and physical symptoms and sensation, then the CBT starts. You need to explain them, giving charts. The diagram should be clearly drawn in front of them. What is thoughts? What are feelings? What are physical symptoms and behaviors? Further, the environment, that is the event. That means many of our people or the clients, they have cognitive dysfunctions or distortions, automatic negative thoughts, schemas which are dormant. They get activated during stressful situation. Hence, you need to tell them event plays a very important role and these cognitive dysfunctions gets activated during certain situation or during stressful situation. That needs to be explained to them. Let's understand how to make aware of these thoughts, emotions, physical symptoms, and behavior to the patient. That can be done by 5-column charts. Before we move that, you need to further give an example. There is an event, that is, my boss yelled at me. Immediately you will feel angry, and over a period of time, I'm sad because the boss doesn't like me. Here, we forget one thing. As soon as the event occurred, we felt angry and sadness. There is an interpretation of the event. That is, I'm useless, I'm good for nothing, nobody loves me, nobody appreciates me, even my parents do not like me. Such kind of interpretation will lead to angry and sadness. So that needs to be told. An event triggers an emotion. That emotion is based upon certain interpretation of yourself, or the future, or the interpretation of the environment. That needs to be clearly told to the client. Only when you have explained that, you will enter into the 5-column explanation or homework assignment. The Beck has clearly told this. Emotions are the royal road for cognitions. Whenever there is an emotional outburst, that means there is a cognitive dysfunction, cognitive schema, automatic negative thoughts that needs to be identified. That means royal road for cognition is identify those emotions which triggered by an event. These are the 5-column chart. If you look at this, although I'm talking about 5-column, there are 6 columns. First one is the time you need to log this. Whenever in the morning the event, what is the event? What are the thoughts because of that event? And at the same time, rate the feelings. That means 0 is you're not feeling much, anything. -10 is feeling sad, feeling depressed, becoming angry, frustrated. More severe, it means -10. Moderately severe, -5. If you're feeling happy, if you're feeling good, you'll be scoring in the positive direction, +10. That means the rating of feelings has to be done at least 3 to 4 times a day. At the same time, an event has triggered the thoughts and also the feelings. Do you have any physical sensations that need to be logged in? And the whole event has triggered certain behaviors that need to be logged here. If you're able to do on daily basis, and after 1 week, when you present it to the therapist will again try to analyze this, and he will be able to explain what are events, what are thoughts, whether you have logging your feelings properly or not, whether the sensation have been logged in or not, and the behaviors. So this thought diary has to be kept, and this need to be explained. The patient will master over a period of 2 to 3 weeks. Once the patient understands about the events, thoughts, feelings, sensation, and behavior, the CBT is going in the right direction. One example. In the early morning at 7 o'clock, you have reached your office, but the boss is yelling at you that you are late by 5 minutes, and immediately you will become angry, and you are so angry that you want to hit your boss. That means you are having -10 rating on feelings. And the thought is, he doesn't like me. How dare he is shouting in front of others. Such kinds of thoughts will be logged here. Sensation, palpitation, sweating. You want to kick him. That means you are also having tremors in the hand. You are about to punch him. At the same time, you have butterflies in stomach, tremors in the hand, and your fist is tight so that you can bash him. So those sensations of physical sensation need to be logged. What is your behavior? You may become angry and shout at him back. So these need to be logged here. At least 3 to 4 times if you are able to do it, or else whenever you have a strong emotions, please log it and discuss with your therapist. And the more you are able to log it, better you will be able to give a picture about your thoughts, feelings, that is emotions, sensations, and behavior. If you're able to give a good picture, the therapist will be able to guide, will be able to identify your dysfunctional thoughts, schemas, distortions, and also your behavior can be corrected. And now, once you are able to log and discuss with your therapist, the therapist will start looking at the dysfunctional thoughts, that is, cognitive distortions, schemas, automatic negative thoughts will be discussed. What are dysfunctional thoughts? These are the general thoughts which will be reported by the patient, like I am not complete, my dad doesn't like me, my boss always targets me, bad things happen only to me. These are the various ways the patients will report. But you need to inquire. The general vague thoughts or statements do not yield any much. So it is difficult to measure, difficult to monitor and assess the outcome. Hence, you need to inquire. You need to probe for specific thoughts rather than general thought statements. You need to ask specific questions. You need to dig into deeper. For that, you need to have Socratic questioning. Hence, whenever the specific thoughts need to be asked, essential targets, because they can be measured and assessed and monitored. For example, the client may say, my boss always targets me. Now, you need to probe by Socratic questioning to get into specific thoughts. And each dysfunctional thought will trigger loaded emotions, explosive behavior, extreme behavior, shouting, becoming destructive. At the same time, keep an eye on the themes, what the patient speaks. Majority of the patients may speak should words. I should be always correct. And they may use always. Always I should be appreciated. Always everybody should say good to me. Every person must listen to me. 100% I should be correct. Otherwise, I will not do the work. 0%. Never ever say this. These kinds of statements, you should keep an eye on them. You need to log them. And you need to give feedback to the client about these extreme statements which the client is making. And these extreme statements are dysfunctional thoughts that need to be told to them. Invariably, 0 to 100% are the extreme thinking which the client has. But however, life is not just black and white. There are gray, shades of gray will be seen. That is from 1 to 99. That needs to be appreciated by the client. And you need to be allowed to make errors because human is error. That needs to be discussed with the client. And this can be done only by Socratic questioning. That is, guided discovery for the client. If you give ready-made answers, the client may not buy it. The client will be able to understand when you are able to help them through Socratic questioning, and he is able to discover his own dysfunctional beliefs through guided discovery. So here, the therapist has to be very careful, and he should learn this Socratic questioning. He will learn by doing this and by observing the CBT therapist how he does it. And to learn this, you have to do at least 20 to 30 therapy sessions with various clients. Once you learn it, it becomes easy to do Socratic questioning. What is the Socratic questioning? Socrates, the early Greek philosopher, teacher, believed that disciplined practice of thoughtful questioning enabled the student to examine ideas logically and to determine the validity of these ideas. That means every person have our own ideas, our own belief system, our own cognitive schemas, automatic negative thoughts. You need to question them. You need to question in a Socratic way. You need to be as ignorant as possible. Don't give ready-made answers. Here and there you may do suggestion. You need to help the client to discover their own cognitive errors. Then the patient will be able to think, yes, I am getting these repeated distortions and its themes are repeating or recurring in my life. Hence, my feelings are contingent upon these thoughts. In this technique, the teacher professes the ignorance of the topic in order to engage in a dialogue with the student. And please remember, people trust if they arrive at the conclusion by themselves. That means the people will believe what they experience. If you tell them, they will not listen to you. So ready-made answers is not going to give any help to the patient. Help people to arrive at their conclusion. Help them to understand there is an alternative way of thinking, alternative way of questioning, alternative way of answering certain situation. Do not debate. Do not confront the patient. Do not be aggressive in your approach with the client. The client need to discover his own thoughts, his own belief system. And be very careful. Do not give ready-made answers. Here and there you can give suggestions. If the client is able to discover their own cognitive distortions, cognitive schemas, automatic negative thoughts, you are able to guide them. Then cognitive behavioral therapy will be very effective and they will be able to cure their illness. Hence, questions should be phrased in such a way that they stimulate the thought process and increases the awareness of the thinking of the client. It's very beautifully has been written. That means your questioning should not make the client to be very defensive. The client should be able to think and also should be able to answer your questions. That means you should not be aggressive in your questioning. And you have to be very careful. You need to do this Socratic questioning once the rapport has been built. The reason being is the patient is revealing his inner core thought. That thoughts need to be discussed. If you have developed the rapport, only the client will reveal those thoughts. Those thoughts which are dysfunctional, those thoughts which he's scared of if it comes to the surface, or else he may deny even the existence of those thoughts. Hence, questioning should make the client to think and about their responses and how those thoughts are creating trouble in their life. Sometimes you need to ask in a way of imaginaries, that is, imagery or guided. For example, if the patient has social anxiety, you need to ask him to close his eyes and ask him that he is giving a public speaking. He has to give a presentation. And now he is about to enter into the hall. Now ask him to go through the process. He says, I am having anxiety. I am having panic attacks. I am unable to look into their eyes. Now you start asking the questions. That means even the imagination or imagery guided Socratic question can be done. You need not expose into the real life situation. Certain times, those anxiety provoking symptoms may yield the avoidance. Hence, so in vitro, you can do this guided Socratic questioning. And this Socratic method is based on understanding the belief, and at the same time, you have to sum up the person's argument. That means you say, I understood like this. Is it right? Then ask for evidence. What are the evidence in favor of your thought? Can it be other way also? Challenge their assumptions. Do not be aggressive. Repeat this process. That means once during the Socratic questioning, you are able to understand the belief. Repeat that I have understood like this. Ask for evidence. Can it be on the other way? Ask certain questions. And then summarize it and repeat this process almost in every session. At the same time, you need to ask informational questioning, be active listening, summarizing statement, and you have analytical questioning method should be clear. And at every time, you need to ask for evidence for the statement if the patient makes. At the same time, evidence against the statement what the patient has made. Alternative view of the statement should be asked, and the client should be able to provide the alternative statements and also consequences of the statement. If the patient says, if I go for public speaking and I'm on the stage, if I make mistake, that means it is over. My life is over. Ask them, what does it mean if the life is over? That kind of questioning has to be done in Socratic questioning. Let's discuss about the examples of Socratic questioning. These are some of them. You seem to be upset. Please explain about it. What is bothering you? What did you do when that happened? What did it mean to you when you thought or when you did that? When was the first time that this thought occurred to you? Did you have any other feelings? And what that happens? How do you feel? When that happens, how do you feel? What goes through your mind when you feel like that? What do you tend to do all those times? I wonder what seems so bad about that. In your view, what does that mean? What does that say about you? What would that mean about your life or about your future? What would other think of you? How would you label that? Can you describe the worst thing that could happen? And if that were true, then what? So these are the various Socratic questioning you should be asking. And the Socratic question, the cue will be taken from the previous answer of the client. And then you will make it a specific question. So the question to be asked usually taken the cue from the previous question. How is your life? The client says, I hate my life. So why do you hate your life? Life has always been tough. What makes you think life is always tough for you? He may say, no one loves me. So what I understood is, no one loves you. That is the reason the life is tough. That is the way Socratic questioning goes. That is taking cue from the previous answer of the client. You will frame the question. You need to be understanding about the what questions. That is W questions. Who, what, when, where, why, and how. And explain more about it. Let me understand about it. Tell me more in detail. Please explain to me. Such questions need to be asked in Socratic questioning. At the same time, when you're asking, actively look for cognitive distortions, schemas, automatic negative thoughts. If you're able to identify them, then you can enter into the next phase, cognitive restructuring. So you need to be very clear how the inquiring or probing is done. If the patient says, boss always targets me, self-evaluation, I'm not good enough, that's the way the patient will answer in his Socratic questioning. At the same time, about the world, everyone hates me. No one loves me because the boss hates me. If the boss hates me, that means everyone below the boss also hates me. So these are the way he's going to have automatic negative thoughts which end in a conclusion. And also he may say, about the future, if I lose this job, my life is gone. I'm dead. So I'll be begging. So he has a catastrophizing. If a person loses a job, that doesn't mean that life is going to end. So these are the important points you need to make and log it. And you need to elicit automatic negative thoughts. At the height of any emotional distress, therapist can unearth automatic negative thoughts. Whenever the patient has emotional outburst, ask him what was going through your mind at the height of your emotions. What thoughts came into your mind? And also, what are the contrary avoidance or safety behavior was there before this? So these are the important things you need to ask. At the same time, you need to ask also, what's the worst that could happen to you if you do public speaking, especially in patients with social phobia. So those things will help the patient that is misinterpreting the clues or else the events. And if the patient says, my boss always targets me, ask for evidence. He may say, the boss 1 week back shouted at me. I avoid him so that he doesn't shout me. Since avoiding him, so he's shouting whenever he sees. So once a week I see him, he shouts at me. At the same time, he says, he avoids me also. At some times, he stares at me. He gives more work to me. These are the evidence he gives. Now you should ask evidence against it. He's like that with you only or with everybody he does that. He may say, he may target me also and couple of others. Ask him. 2 days he shouted at me and also at my colleague. Then, did he fire anybody employees? How many he has fired till now? Why he has not fired you? Yesterday he was fine to you? That what does it mean? Previous year I received promotion. That means what does it mean? If the boss is targeting you, why is he giving promotion to you? Why he has not cut your salary? So these are the questions. Evidence for and against need to be discussed. Further, if a lady says, I'm a failed mother because my son failed in the exam, ask for evidence. Evidence is my son failed in the exam. My daughter's marriage failed. My husband lost job. Now the evidence against this. Like if your son has failed in the exam, most probably he has not studied. That is the reason. Or else your daughter's marriage failed. My son-in-law is abusing your daughter. That is the reason marriage failed. The husband lost the job because of economic meltdown. That doesn't mean you are a failure mother or a failure lady. Now, one of the best way I can give an example is, he says, my son failed. I am responsible 100%. when the client says that you need to quantify the responsibilities, this is how you are going to ask. You ask, since your child failed, that means you are 100% responsible. Let's quantify it. You said 100% you're taking responsibility. Suppose if you told him to study, will he study? He says, no, he doesn't study. That means there is a share of responsibility from your son also. And during the exams, how was his health? No, during exams, he had fever. That means illness also played a role. How was the question paper? Question paper was tough for everyone. That means even the question paper also had some role to play. What about his friends? How much time he used to spend time with the friends? The lady may say, the friends played a major role for not allowing him to study. Whenever he used to sit for study, friends used to come and disturb him. At the same time, you can ask, how much was the internal assessment? The lady may say, the internal assessment marks was very low. The teachers did not give him. At the same time, you can ask, how much time he is spending on the mobile, on the internet? She may say, almost 20 hours he is spending per day in internet and mobile. That means when you give all the explanation, her percentage will be around 20% responsibility. But however, she told 100%. Those kinds of estimating the responsibility, evaluating thoughts is very, very essential. Then only the lady will have the responsibility assessment, or else abnormal risk assessment, abnormal responsibility assessment can be assessed thoroughly, and the feedback needs to be given to the patient. And then the cognitive restructuring starts. Especially in panic disorder, the patient will have catastrophization. If I go out, I will have increased heartbeat, I may fall down and die. That means here the patient has extreme catastrophization. Here you need to ask him, how many people when they go out, if they have increased palpitation, how many of them will fall down? If you run fast, you have increased heartbeat, how many of them die? Similarly for OCD, all or none phenomena will be there. The patient says, I have to be extremely clean, hence I will take bath for 7 hours. If I don't take bath for 7 hours, I will not take bath at all. And hence, they will not take bath for nearly 1 week or 2 weeks. They will be very dirty. Then again, you have to do cognitive restructuring. You say that you need to be clean. At the same time, on the other hand, you are very dirty. That means since past 1 week, you are not taken bath at all. There you are going to bring down their cognitive belief. 0 to 100% is not the way to go. Similarly, for social anxiety disorder and generalized anxiety disorder. And you need to talk about accepted risk and not the catastrophization. That means when you go outside, you may have a panic attack because suddenly there may be a vehicle coming in front of you and he may stop in front of you and you may have a panic attack. That means it is an accepted risk. That doesn't mean that you are going to fall down or else you will die there. At the same time, when you do cognitive restructuring, you need to identify those repetitive themes, repetitive cognitive distortions which are coming in the way of the client. You need to systematically challenge them. And you need to ask for evidence for and against those cognitive distortions. You need to look for automatic negative thoughts, look for cognitive schemas and cognitive core beliefs. And you need to challenge them. You need to ask the patients to give evidence for and against. Along with this, now you will move into behavioral activation techniques. Behavioral activation is a structured therapeutic approach that aims to increase the engagement in adaptive activities, decreases the engagement in activities that maintains the psychopathology or illness, and solve the problems that limits the access to reward. This is what is called as behavioral activation. The behavioral activation is done because if a person is sad, he'll be withdrawn and he will not sleep most of the time. And most of the time he's laying down on the bed. And then he has lost job. And again he's sad. And if he's sad, he'll not go outside. He will not make efforts to look for the job. If he doesn't have a job, again he will become sad. This vicious cycle will continue. Hence, now you have to break this cycle. To break this cycle, you need to do behavioral activation. That is what is called as behavioral activation method to break the cycle of this feeling, thoughts, behavior, and physical sensation. That is very important here. And this behavioral activation, the intervention can be done by asking him to go and meet outside, go and look for the job, and ask him not to be laying on the table or on the bed for longer duration. At the same time, asking him to apply for job, go for the interview. So those kind of behavioral activation needs to be done. Once he starts going outside, he will start meeting people. Once he starts meeting people, he may get positive feedback, or else he may have also negative feedback, but this cycle starts breaking down, and then his illness starts getting cured. And hence, thoughts, feelings, and physical symptoms, behavior, relation should be developed here. And the patient should understand how these thoughts, feelings, behaviors, and physical symptoms is playing a crucial role in maintaining his psychopathology or illness. And the environment is one which triggers, especially during the stress. That needs to be understood to the client. Hence, the behavioral activation plays a key role. The behavioral activation changes his thought process, further his feelings and physical symptoms. So behavioral activation is you are making changes in the behavior. In cognitive behavioral therapy, you will make changes in the cognition by identifying the cognitive distortions, schemas, and automatic negative thoughts. You are intervening at the thought. At the behavioral activation, you are making changes in the behavior. That in turn will changes his thoughts. That is how cognitive behavioral restructuring can be done. That is where CBT plays a very essential role, both at the cognitive level, at the behavioral level. So in behavioral activation, you will discuss and focus on his hobbies, passion, and pleasurable activities. You need to ask him to go for reading if he likes it, dancing if he likes it, singing, jogging, which makes him happy. You need to have activity scheduling, and activity structuring has to be done. Social skills training need to be done. And here, when he does the activity scheduling, it will be done by the client. The therapist is going to assist him in doing this activity scheduling. The therapist is not going to dictate. Here, he will assist the client in doing activity scheduling and structuring. At the same time, you need to shape his healthy behavior. You need to bring in reward, that is token economy. Sometimes you have to be gentle persuasion is required in certain patients. On the daily basis, you need to document, because majority of the patients will have micro gains. Over a period of 2 to 3 weeks, you can find there is a major changes. On day-to-day basis, the changes do not occur significantly. Over a period of 2 to 3 weeks, you can see around 3 weeks back, you never went out of the house. Now, at least after 3 weeks, you're spending around 6 to 7 hours outside the house. That means there is a significant change. So you explain them and ask them to do more what it matters for them. That will help in behavioral activation and breaking down the laziness. At the same time, you need to start exposure therapy. Exposure therapy is defined as a treatment that encourages a systematic confrontation of the feared stimuli, which can be external stimuli, that is feared objects or activities or situations, or internal, fearful thoughts or physical sensation. That needs to be challenged. Again, it is a behavioral method. The behavioral activation is one, and exposure therapy is the second one. Exposure therapy is a type of behavioral therapy that is designed to help the people to manage their problematic fears. That is, facing your fear, or else facing their fears. You need to explain about the habituation technique. If they are able to face their fear, there will be increased palpitation. If they are able to tolerate their palpitation over a period of time, those habituation will develop, and they will be no longer will be feared with that stimuli. And you need to explain about the avoidance, switching behavior, switching compulsion, need to be told and not to do those things. At the same time, safety behaviors need to be avoided. Exposure scheduling should be done, and this scheduling need to be done on a systematic way. That is, graded exposure should be done. Least anxiety-provoking stimuli should be exposed first, and slowly in a graded fashion, the person should learn to overcome those simple anxiety-provoking technique to a highly anxiety-provoking stimuli to be done in the last. So hierarchy of anxiety-provoking situation needs to be documented, and the exposure should be started in a graded fashion. Sometimes you need to teach them relaxation. That means the patient, whenever he has extreme anxiety and is avoiding, then you may need to teach relaxation, or sometimes you may need to give benzodiazepines. Along with this, you need to teach them problem solving techniques. Identify the real problem to the client, at the same time help the client to find the real problem. Discuss about the problem. Ask the client to find a solutions for his problem. Those problems may be silly, solutions may be there, innovative solutions may be there. Ask for extreme solutions, alternative solutions, all possible solutions he can find out. Document them. Weigh each solutions, answers, implement the chosen solution. Be flexible to switch the solution from one to another. What are the different ways you could handle your problem? That needs to be the question. What would you suggest to someone who had this problem? Suppose the patient says, I have this problem. Suppose your friend comes with a similar problem. How do you give advice to him? What do you think a friend or someone who cared for you would suggest if he or she knew about your problem? That means you are bringing self-compassion. Majority of our patients will be very critical about their self, but whenever they have to advise to their clients or their friends, they will be very generous. But they will not be compassionate to themselves. That needs to be highlighted. If there is any positive information that you are ignoring, that could be helpful in solving this problem, that needs to be brought in. That is creative, innovative way of solving the problem. Is there any aspect of the problem that cannot be changed that you have to accept? Imagine if a patient says, I have developed diabetes mellitus. Now, there is no answer for that. There is no cure, but there is solution how to manage diabetes that you need to accept and start working towards it. Find a possible solution and weigh the solution. That should be the way to go about. And this is the chart how you can show the patient how he has to find the problem, what are the solution, what are the short-term benefit, what are the short-term drawbacks, what are the long-term benefits, what are the long-term drawbacks that need to be discussed. And do not give ready-made answers to the client. You may give one or two suggestions, but the client need to find his own solution. You need to empower them to find their own solution. You are not there to give ready-made answers. You need to guide them to find their answers. By guiding them, you are empowering them. The best example I can give you is, don't give fish. Teach the fishing technique so that the client can find his own fish. That is what is very essential. In CBT, you need to teach them, you need to teach the skills to overcome their problems. Now, once the patient is able to identify certain problems, identify certain cognitive distortions, schemas, automatic negative thoughts, is able to work with them. Once he is able to solve some of his problems, now you need to discuss about weaning of the sessions. And you need to tell the CBT is not here to cure all his problems. Few problems will be solved. Once he has learned the technique, he should use the technique at home and practice it. If he's able to practice over a period of 3 to 6 months, he will be able to get out of his depression, OCD, or any other anxiety disorders or any emotional disorders. And before you start the weaning process, you need to discuss with them. Space the sessions. Earlier, if you are doing a session per week, that may become one session fortnightly, or session monthly, a session bi-monthly, or else 3 months one session. And focus on relapse prevention, empower the client. At the same time, booster session should be done, maybe 6 months once or 3 months once. After the main sessions are officially ended, in order to reinforce the progress or troubleshoot the obstacles to maintenance of positive changes made during the relapse, during the therapy should be enhanced. At the same time, booster sessions are required during the time-bound or crisis-based can also be planned, so that the client knows the therapist is there. If I go into any trouble, you can approach him at any time. So that lapses are known, relapse should not occur, hence the booster sessions are there. To summarize, my friends, identifying a problematic situation, rating the feelings, physical sensation, and behaviors is the hallmark in CBT. Patient needs to understand them, do homework assignments, log these thoughts, behaviors, feelings, and physical sensation. And by doing this, you'll be able to identify the dysfunctional thoughts, choose those dysfunctional thoughts, challenge them. Challenging by asking for evidence towards those thoughts, evidence against those thoughts, and create a balanced or alternative thoughts based on all the evidences. Rates the extent to which he believes the new balanced thought. Rate the feelings of the client, and the client is able to feel better once the therapy starts progressing. To conclude, CBT is the most extensively studied psychotherapy. A wealth of evidence in supporting CBT is there across all diagnoses in psychiatry. CBT is found to be effective in patients across the lifespan, that is from children to the geriatric population. Thank you very much for giving your valuable time. Stay safe.